Spectrum on Radio 1 FM 90.
Spectrum wants to hear your views. You can SMS at any time during the show. Type Spectrum, leave a space, type in your contribution and name, then send it to 7197. Your views, our interviews on Spectrum, Radio 1 FM 90.
Hello, a very warm welcome. This is Spectrum on Radio 1. I'm your host, Edmond Kizito. Good evening. On Spectrum tonight, what are the emerging concerns about the management and access to cheap drugs in Uganda? One of the key challenges affecting service delivery in the health sector is the mismanagement of drugs, leading to acute shortages, sometimes expiry of drugs, and supply of substandard drugs onto the market. Often we read and hear about how drugs worth millions of shillings have expired in one health center, yet the same drug is urgently needed in another center. You would also have read about fake drugs being on the Ugandan market despite the dangers to the health of the users. The National Drugs Authority is mandated to ensure that Ugandans are protected from such dangers. The question is the NGA doing enough to deal with these challenges? The cost of drugs is also becoming a serious problem, given the emergence of complicated diseases, including HIV and AIDS, which require a lot of money to treat. This, however, can be mitigated through a provision of generic drugs, and we'll know what exactly this means. However, drug manufacturers are influencing legislation in many countries to stop the production of generic drugs, which are a lifeline for healthcare systems in lowly developed countries. During the 8th Parliament, government tabled a bill entitled the Industrial Properties Bill 2009, which seeks to safeguard the use of generic drugs. But it's not clear what the fate of this bill is at the moment, yet time is running out. If Parliament does not enact this bill into law, permission to manufacture cheap generic drugs will cease in 2016, and the alternative will be for Uganda to buy these drugs expensively from the original manufacturer. Now, a group of civil society organizations have already petitioned government about this matter, and they are also appealing to parliamentarians to act. So tonight we'll look at some of the emerging issues and the management and access to drugs in Uganda and what exactly needs to be done with the situation. Our guests tonight, Mr. Moses Mulumba, Executive Director, Center for Health, Human Rights and Development. You most welcome, Mr. Mulumba.
Thank you.
That's a health rights NGO, a health rights advocacy group. We also expect to be joined by Honorable Dr. Gordon Sematiko, the Executive Director of the National Drugs Authority. He's on his way to this place. Can you, to begin with, tell us exactly what a generic drug is?
A generic drug is this version of the drug that is produced not necessarily by the person that originally produced the drug. When a person produces a drug, they go through a lot of processes. You do a lot of research, you do a lot of work to develop the drug. So as a result of production of this drug, you actually are rewarded by what is called a patent. Now, a patent is a protection over a drug for a period of 20 years, depending on the national legislation. In some cases, it goes beyond 20 years. Now, when a person receives this patent protection, he bars the rest of the people to rework the drug that he has produced. Now, within the international legal regime, there is what they call the TRIPS agreement, the Trade-Related Aspects of Intellectual Property Agreement, which talks about the rules that are governing patents. It clearly mentions the rights of the patent holder, but also these days has adopted what we are calling the flexibilities. These flexibilities enable people in society to access drugs even when this patent is still existing. It became a very big issue in South Africa when HIV/AIDS had just started, when the big pharmaceutical industries actually sued the government of South Africa when it wanted to amend its section, I think it was section 10 to include section 15C, that was permitting the production of drugs by other industries, that was permitting the importation of drugs. Because when you have a patent, you don't just forbid other people from production of the drug, but in also dealing with the drug, including trading in the drug. So these flexibilities offer an opportunity for another person to actually produce this drug, because before a patent is granted to you, as I've said, it's a reward from government or a reward from society for your innovation. You submit all the information, including the data that you
to that governing authority.
Yes, to the governing authority. Now, the thinking is that when you submit all this information, at the expiry of the 20 years, we don't need to come back to you to produce this particular drug. But this is becoming very complicated with diseases such as HIV/AIDS, where, for instance, a drug that is 10 years old, it's no longer as effective as one may wish. So you then start receiving new patents, new information that is coming in. And if you do not use the flexibilities that we are talking about, then you'll never be able to allow people access these cheaper drugs. Now, it is within the flexibilities that people are able to manufacture. You use the data that someone submitted and you reward them with what is called a royalty, which in most cases the big pharmaceutical industry would not want. They would prefer a monopoly over the drug. So one of the flexibilities, for example, is a compulsory license, where a third party is actually enabled to produce the same drug that is on a patent, but on condition that you actually you pay back the person that owned the patent. It's not stealing away someone's right, but you're kind of developing a system that will enable other people to produce, such that people that access the cheaper drugs. Now, the drug that is in most cases produced becomes a cheaper version of the drug, because there's no science input, because there is no R&D, research and development that has happened. Now, this is what is not explained to people. When you go to a clinic every day, you'll find Panadol, and someone will simply tell you, this is Panadol from India, and this is Panadol from Germany. Which is actually paracetamol. It's a paracetamol. It's a paracetamol. Yeah. So, when you actually see that one price is much higher than the other, you'll actually think that probably one is more efficient than the other. But these drugs are actually tested by the Drug Regulatory Authority. And they're the same. And they have the same efficacy. Mild side effects. Yes. So, you must make sure that before a drug is actually approved, it has the same efficacy. Now, these drugs that have been produced in countries like India, because India is one of the countries that has been able to make use of the flexibilities, and that's why we see that almost 80 or 70% of the drugs coming into this country are from India and countries like Brazil. We can't afford the generic, the ones that come from the patent. Now, if a drug is on a patent, in most cases you'll find it's 50 times or 20 times more expensive than the drug that's not on the patent. If you bought a drug at 1,000 shillings from India, if you bought it from the manufacturer, it would cost 50,000. Yeah, you may be able to find a drug that is 1,000 and it's about 20,000, or a syrup that 1,000 versus 20,000. So really the price differs. There's no specific formula for that, because some drugs have gone off patents for quite a long time. The ones that have been manufactured for a long time. South Africa has been consumes 1/4 of the world's ARVs. Recently, they decided they'll create a state-owned enterprise to manufacture their own drugs. How are they supposed to do that? Now, what usually happens is that the government has a big role in terms of ensuring that public health goods, for instance drugs, continue to be protected. And one of the sure ways of protecting these goods is actually to have a government-owned manufacturing plant. Yeah, we sold all ours. Now, in the context of Uganda, in the context of Uganda, we used to have seven pharmaceutical manufacturers, but these are all generic manufacturers. None of them is doing R&D. Even Quality Chemicals, which is big now, is actually depending on patents, drugs that are off patents or drugs that have got licenses by its partner company Cipla in India. So you find that even the six are actually just generic manufacturers. So it is very, very important that we start thinking about not just relying on drugs that have been imported into the country. Even the questions of quality are actually much easier to control when you're doing much more national production than just relying on imports, looking at the kind of systems that we have in the country. Very briefly before we move forward, let's talk about Cotem. Cotem costs 20,000 on the open market. Is that the actual price? Is that a patented drug or is it a generic drug? Now, that will again depend. You may find that there is some Cotem that is much cheaper than a patented Cotem. So there's no specific formula. This really depends on a particular drug and the company that manufactured the drug in the first instance and the company that makes use of the flexibility. Well, listeners, this is Spectrum on Radio 1 tonight. What are the emerging concerns about the management and access to cheap drugs in Uganda? Our guest tonight, Mr. Moses Mulumba. You've just heard from him. He's the executive director for an NGO Health Rights Advocacy Group, Center for Health, Human Rights and Development. We've just been joined by our second guest, Honorable Dr. Gordon Sematiko. He's the executive director of the National Drugs Authority. You're most welcome, Dr. Sematiko.
Good evening. I want also to greet the listeners, and I would thank this program, Spectrum and Radio 1, for inviting me to participate in this very important discussion.
How accessible are drugs in Uganda, Dr. Sematiko?
Drugs in Uganda have been made to be accessible by the policy of the government of Uganda. First and foremost, by removing taxes from drugs. Drugs are tax-free. So if you import drugs, you don't pay any taxes. The only fees one pays is to National Drug Authority, what we call the verification fee, which is 2% the value of drugs. And for donations, you pay only a token of 50,000 shillings to enable National Drug Authority operate. I would say that 2% which patients pay, the importers pay, is to enable National Drug Authority to operate, because we don't receive any funds from government to manage the authority. We manage it using that fee. So generally, one of the access principles is to make them tax-free, and the second one is government policy to encourage access. You find the drugs which the previous speaker was talking about, like the ARVs, unlike other drugs where we have very stringent, I would say, long process of registering. The antiretroviral drugs are fast-tracked. That means we fight to make sure that access to new products is available to the Ugandan population.
How long does it normally take to register a new drug?
It can take to more than a year
to register
a new drug on the market because of the process. But for antiretrovirals, we try to make sure it doesn't go beyond 3 months.
3 months.
Why the process is long? Because it involves inspecting of the factory where the drug is coming from, the dossier, that is the technology behind the drug, the clinical trials where they were done, the bioavailability, all those issues. So you really need a lot of intensive care to make sure the drugs reaching the Ugandan are of quality and easily accessible.
All right.
Yeah, the other policy of government which also ensures accessibility is the promotion of the generic drugs. Even the essential drug list for Uganda emphasizes using the generics, that is not the brands, because the generics are affordable.
They are copies of the original thing.
Sometimes even the very original manufacturer can produce a generic. Like when you find like a Ventolin inhaler, the very manufacturer changed and produced salbutamol, because that's cheaper for the market. But because, as the previous speaker has just said, the innovator companies have to recoup the money they spend in research, and they have also to prepare more money to research for new molecules.
And these are large budgets. I've looked at some of the companies, the Procter & Gamble.
Yeah, we are talking of
they spend billions of dollars.
Billions of dollars.
And they could take 15 years researching on one drug.
Even more than 15 years. And you can get like 10,000 molecules, and only one qualifies to be registered as a drug. So all the research done in the other 9,900 is lost. So it's not cheap to produce a drug, and that's why you find them relatively expensive. But also it raises the questions that if we completely ignore buying anything from them, the question is,
will die. I mean, if someone has spent 15 years doing research, you need to pay for it.
The industry will die. So we leave the developed countries to do more of buying of the innovator products, so that we can also cure our people
using
but
cheaper.
Also using cheaper
What are the most common ailments in Uganda?
The biggest, I would say malaria has been taking our biggest chunk the drugs.
It kills more people than AIDS, we know that.
And definitely in the range of products on the market, we have very many antimalarials. And that's where even our challenge is, because we have to access antimalarials. And that's where, like, the counterfeiters would target, because they look for a product which has a quick turnover. So we have a big challenge in those antimalarials, and of course even painkillers, because almost every disease comes with some pain. So it is another range of products which is commonly on our market. HIV/AIDS has peaked because, in terms of also monetary value, it takes a big chunk, because antiretrovirals are more expensive. You can use the money to treat, for example, like 100 patients of antimalarial on antimalarial drugs. The antiretroviral drugs will treat only one patient.
Really?
The equivalent. Some I don't have the exact statistics, but you can see, yeah, that the scale of, in terms of value, the antiretrovirals were very expensive. So you only have to turn to the generics if you are to manage to treat as many patients as possible.
And government has ARVs given out free in hospitals?
Actually, one of our biggest advantages as Uganda is, first and foremost, we are so far the only country, I think, other than South Africa on the continent, and maybe Egypt was trying, which has a factory which produces antiretrovirals, and it is WHO certified. So the quality chemicals we have here, actually next week, WHO inspectors are coming to review the performance of quality chemicals, because they want to expand the range of products which are allowed on the international market. That is a very big tick to the government of Uganda, and you find all the East and Central African countries are running to Uganda for this. So I find the government policy is very important in the area of accessing medicines for its people, and also the local companies like Kampala Pharmaceutical Industries, KPI, and the others also were given some leeway by government. I think it is a 15% when they tender to enable this local production to be supported, because that's how countries like India have money to support their local industry. That improves on the access of drugs.
All right, Mr. Mulumba, are you happy with the way things are going? You've explained what government's intervention. Does that satisfy you?
I think much as a lot of effort has been put in to ensure that people continue to access medicines, there are a couple of issues that still need to be looked into. Some of them are systems issues. The policy of decentralization, how do you ensure that a person at the village level is able to access these drugs that have come into the country or that have been manufactured into the country? But I also think that I will take an example of quality chemicals, which has been brought up as a good thing, and Uganda is praised for that. Now the question is, why is it that some of the drugs that are produced by quality chemicals are still much more expensive than the drugs that would be imported into the country? Sometimes you may not blame quality chemicals per se. We need to look at several other factors that probably the government needs to work on to ensure that even when national industry is coming up, people are supported. Just I think about 2-3 weeks ago, the special rapporteur on the right to health was in the country, and one of the biggest
United Nations Special Rapporteur.
Yeah, United Nations Special Rapporteur, Anand Gruver, and one of the biggest points that he made was the question of the cost of electricity and how it's impacting on local manufacturing. Now, if we are to move towards 2016 and intellectual property laws are going to be enforced, we are going to be relying more on local manufacturing. We need to see much more government support towards local manufacturing. We need to see this confusion. We have been doing a campaign that is supported by the Open Society Initiative for East Africa on moving away from confusing the generic version of the drug with counterfeiting or with substandard. because currently one of the biggest things that we have in Uganda is people don't respect locally manufactured things, not just books, not just cups, but also drugs. So people would actually prefer to have drugs that are coming in from outside the country. So much more work needs to actually be done to ensure that local manufacturing continues to be supported. Now, much as again a lot has been said on what the government is doing, I also think that the legal and policy environment still needs to be reworked. I think we may be getting to that question later.
What do you mean the legal environment?
For instance, for the generic medicines to exist, as I said in the first presentation, you need a very clear legal framework that is supporting that. Now, once we get into 2016, right now a company may be producing a drug that is patented, but because Uganda is a least developed country, under the TRIPS agreement it has been having this policy space. When Kenya, the policy space was lost in 2005, we have seen a lot of litigation, suing government, suing local manufacturers for infringing on patents. And as a result, Kenya is actually relying more on the parallel importation provision, which is a flexibility in the TRIPS agreement that is provided. So you cannot infringe, but you can go ahead and parallel import, because under parallel importation, if a manufacturer in the US is having a branded drug, is bringing it on two markets, one in Uganda and one in Kenya, but is selling the drug in Uganda much more expensively than in Kenya. Under intellectual property, if you went and imported that drug from Kenya and brought it into Uganda, it would be infringing on their patent. Now, your national legislation must accept that much as we are recognizing the patent, when it comes to some drugs, they need to be parallel imported where the prices are much more expensive.
That's kind of market discrimination, though. That's what they call it in economics. But is that because our laws are bad? You have drugs from the same source costing, they're costing cheaper in Kenya and being more expensive here?
Now, it may be a practice by the manufacturers. I don't know what the economics may be, or it may be as a result of an
maybe the market is bigger on the other side.
Yeah, or it may be an agreement between the government of Kenya and the other government, and therefore drugs become much cheaper. So it can happen in several ways. For me, my question that is, if it happens, how do you go about it?
Well, what should the government do about it?
So the government now needs to make sure that the current patent law that is being revised by the industry, that is going to be replaced by the Industrial Properties Act, for instance, does not require the consent of the patent owner to have these drugs parallel imported.
The Industrial
Properties Bill, yeah, which is before Parliament, and it's supposed to be passed in any way by 2013, because Uganda has to comply with its obligations under the World Trade Organization. That's just an example, but also the questions of patentability criteria. Before you give a drug a patent, there are considerations that you must take.
All right, maybe let's go for a break. We'll talk about those. When we get back, this is Spectrum on Radio 1. Tonight, what are the emerging concerns about the management and access to cheap drugs in Uganda? We'll be back.
You can pay, you can buy, pay your bills, pay school fees, send cash overseas, pay taxi fees, and salaries, anything you need.
You can do anything with MTN mobile money. And now, for the first time in Uganda, you can even pay your electricity bills. Go to your MTN mobile money menu, select pay bills, select Umeme Touch Pay, and follow the prompts.
MTN. Everywhere you go.
John, Mike and I, we go back a bit. We knew John at the beginning, working for someone else. But he was different. He had vision, saw opportunities. He started working towards his goal, opened his own garage, and worked, learning the hard way. His reputation spread. Trust, consistency, quality. Soon people were coming to him from all parts. He made himself and his whole street prosper, and also helped friends, seeing potential in people and helping them on. But John never shouts about all his success. He's just who he is. Special.
So here's to men like John, who make a difference, who enjoy Nile Special, the rich, satisfying taste from the source. Nile Special.
You've earned it.
Not for sale to persons under 18.
Climb to the top of a monument and look over the history of a country. Count flags from over 100 countries, all in one city. Catch up with your friends and family. Explore a city that welcomes the world and an airline that does the same. Fly to Washington, D.C. daily via Dubai, starting 12th September. For more information, contact your local travel agent or Emirates on 417-710-444 or visit emirates.com/UG. Fly Emirates. Hello tomorrow.
Spectrum on Radio 1 FM 90.
Welcome back on Spectrum tonight. What are the emerging concerns about the management and access to cheap drugs in Uganda? Our guests tonight, Honorable Dr. Gordon Sematiko, the Executive Director of the National Drugs Authority, and Mr. Moses Mulumba, Executive Director of the Center for Health, Human Rights and Development. That's a health rights advocacy group. You will be able to call in and contribute to this discussion or even ask these gentlemen questions. Both of them are Executive Directors coming from different places. Dr. Sematiko, we hear about drugs rotting in stores.
Actually, there are so many issues leading to drugs which are declared to have expired in stores or in health facilities. First and foremost, until recently, we had several importers of drugs for public facilities. You had several programs in the Ministry of Health importing. National medical stores would import, and then they will collide at the facility level. For example, you'll find the malaria program importing, and National Medical Store imports the same quantities of drugs, and they are supplying the same end user. Now, that was one of the issues where you'll find that drugs brought by National Medical Stores might not be consumed because they can't plan together. No one would know each other's stocks, because some of them are programs which are fully funded by external supporters. Of recent, that one has been partly resolved because all importation of drugs for public institutions are now being imported directly by National Medical Stores. That is for the army, for the prisons, for government hospitals and the local government hospitals. So that is partly resolved, so we get less and less expiries due to parallel supply. Secondly, it is also an issue of quantification. Who estimates which quantities of drugs to be used in health center X or Y? Now, there was a push system, that is, from the center, they would just say, let's give every health center 100 tins of chloroquine, for example. Now, irrespective of whether it is a very busy one or it is not busy, they will get the same quantities of drugs. So those which are not busy will not utilize the products. Apart from that, determining the disease pattern. Now, if they say they are sending anti-malarials, the same quantities to Kavale, same quantities to Busia, same quantities to a health center in Luwero, there will be a discrepancy, and definitely there will be a problem. The other issue is accountability. Even if the medical superintendent of a health center or a hospital in Jinja knows that he has been supplied excess, he did not have the right to say, let me donate half of this
to somebody else,
because he will be asked to account what he was given, how he used it. And so that also, the accountability aspect brought problems in determining the use of drugs. I think last but not least, the other very, very important issue is the very big shortfall in professionals in our health units.
We don't have enough doctors.
We don't have
but cleaners know
enough doctors.
Mortuary attendants become doctors.
Definitely, and they don't know what to prescribe, because if you take, of recent I got information that a whole regional referral hospital like Kavale has one doctor. So you find if he gets these quantities of drugs, then it means the cadres who are not competent enough cannot prescribe the drugs, so they will end up being in the store, and the patients who cannot access. So I think one of the cause.
Let's get this clear, doctor.
Yes.
The drugs are in the health facility.
Yes.
The people are there. There's a wall dividing the two.
Yeah, and there is there is a lack of a health person
qualified
to handle and be able to prescribe those drugs. So at the end of the day, they will end up expiring in the store because nobody knows exactly how to use them.
That sounds like sin, S-I-N.
Definitely, but you see, the Minister of Health has been crying to government to lift the ban on recruitment of staff. The ban is not being lifted. So there are several issues. It is not usually because people intend to have drugs expire, and then when we spend money to destroy them, those are some of the issues which we think we must address in totality to make sure that services are delivered to the people. As if you moved around this government, one of the credit it has built health units in almost every sub-county of this country,
yes.
But you'll find the health units lack the technical people to manage them.
That's why the motivation
So as National Drug Authority, for us, our major concern there is to make sure that a quality drug has been assessed, because one of the issues which we do to make sure people get quality medicine, we inspect all the factories where these drugs come from. We check
yes. You've done your job.
Yes.
But the problem is in another
now the problem is at another center. Then we are faced with the task of getting these drugs expired from those places and make sure we destroy them.
And destroying them, you don't just throw them away, because they have special experts who dispose of those people.
And they will pay highly to destroy drugs. So it's really very painful for us when it reaches that.
Let's move forward. Mr. Mulumba, let's talk about that law, the Industrial Properties Bill. Explain to us what it is.
Now, the Industrial Properties Bill, as I've mentioned, is addressing questions of patents. And these days, even if you do a Google search on patents and medicines, I'm sure you'll get thousands of pages. So there is a very big relationship between patent protection and medicines, because medicines are innovated. And when someone innovates, the legal system rewards them by giving them a patent. Now, as I said, you have to use flexibilities that are available to make sure that people access medicines. Some of the key issues that one may want to look out into the bill, and these are not just suggested into Uganda, but they are all over the world, are questions of the patentability criteria. At what point in time do you give someone a patent? Would you give someone a patent on a traditional medicine? Because that would not be acceptable. So we need to see that clearly defined in the bill, which is not the case in the current design of the bill. There are questions on
patent a local drug, locally manufactured drug.
Not
a traditional
drug, because you can't patent something that has been known. You must have innovation. You must innovate. You must come up with an innovation.
Let's examine this. I know someone. I had one of my children got a cough, a very bad cough. We treated it with all the drugs in the pharmacy, and it couldn't go. Then my wife went to my mother in the village, and she made a concoction, and the child was healed without any side effects. She can't patent that.
Now, if it is something that is known as a traditional drug that has been used in the community, you cannot patent it.
So how do if you wanted to standardize it?
Because now the practice has been that communally we used to own things communally, so it becomes very difficult for you. You may find that she's not the only one who knows it,
but she has the formula. She's taken some steps.
So if she has the formula and she has taken some steps, probably she can patent what herself has been able to add as the value, but not what has already been existing. Now, the problem has been that the big pharmaceutical industries come and discover these sort of practices, and they go on and get patents over them. Now, even people that practice them become very difficult to use what they have been using, because you will end up being sued for someone's right.
So the other thing, for come and get a formula, patent them in the US and sell them to us.
Yes.
Is that a good thing or a bad thing?
It's extremely bad, because then, one, they are going to be rewarded for something that they have not innovated, which is not acceptable in intellectual property law, but also at the same time the community ends up losing. But then there are also other things. For instance, if there is a new use of a drug that has been discovered, my mom is a nurse. She usually uses Fragile, when you crush the yellow Fragile, and use it for a fungal infection in the feet. So if you go ahead and know that fragile is used for treating stomach upsets, then you realize that when I use this powder for another purpose, I can also go on and get a patent over it. It becomes extremely wrong. So under the legal regime on patent, that should not be permitted. But then there are also questions of naturally occurring substances.
Yes.
Something naturally happens, and then as a result you get a product out of it, and it can be used as a drug. So all those should not be patented. It might be, for instance, a crop. A crop, as a part of the process of its growth, it produces some kind of fruit or whatever that are being used. So you cannot go ahead and patent that. It becomes extremely difficult. So our law should not permit that, because then we shall be seeing more patents happening. But then there are also questions on research exceptions, because one of the exceptions that is permissible under the flexibilities, you should be able to allow people to do research even when the patent is still existing. Now, the importance of that is that the moment the patent expires, you don't have to wait for 20 years to do further research in it. And when you accept that research to happen, it should be for commercial purposes, because the current law that we have is actually only accepting research to be done for experimental purposes. So you make the research, you don't bring the goods on the market, but you wait for the 20 years to expire, such that the day the goods expire, you have stockpiled, you bring the goods on the market. If you don't recognize that, it becomes difficult, as you will spend other years doing more research on that.
Okay.
As I said, I talked about a compulsory license. A compulsory license is an authority given to another person to produce this particular drug. You don't need to make it a very lengthy process. For instance, making it a very lengthy court process. It should be easy. We should see the National Drug Authority and the Ministry of Health playing a critical role in ensuring that people are able to be given compulsory licenses to produce drugs that are necessary. So all these need to be incorporated into the industrial properties law, such that when 2016 comes...
Let's talk about 2016. I would like you to give us an idea about Uganda's patent regime. What drugs do we have for good? What drugs could have their patents expiring?
Now, at the moment,
when you say 2016, some people think about you talk about elections, but let's talk about drugs.
Now, Uganda, the World Trade Organization classified countries into 3 categories. We have the developed countries, and underdeveloped countries, when they signed the WTO agreement, they were supposed to immediately comply with the obligations. Then they have what they call the developing countries.
Yes. Developed countries,
developing countries, and then least developed countries.
Then us, we are at the bottom.
We are at the bottom. Now, countries like Kenya, Kenya actually is a developing country. India is a developing country. They had up to 2005 to have their legislation passed such that they can no longer work patents. So they only use flexibilities. Now, Uganda is an LDC. We have up to 2013 for all intellectual property related aspects. But for medicines to comply, in order for one to start enforcing their patents in the context of Uganda, it's 2016. Now, we need to use this particular period to promote local production, because if 2016 comes and we don't have people that are already producing generics, it becomes extremely difficult.
Could you explain that to us in a minute, Dr. Sematiko?
Yeah, definitely our biggest concern before we reach the 2016 is that the bill we have in Parliament was defining generic drugs as counterfeits, and yet we are relying the old bill was relying on the generics. So we think by supporting our local industries, technology transfer like Quality Chemicals is doing, and also the government putting in subsidies. You see, countries like India, they give their local industries a lot of subsidies, like on the electricity tariffs and the other utilities, and the taxes on equipment and the raw materials is very important.
So what should government do?
Government should do look into support of local manufacturing and technology transfer, both human, because if you go like Quality Chemicals, we have several experts, and also the equipment and utilities, and definitely to make sure that the legal system of importation is also streamlined to make sure that we benefit as a.
And the pharmaceutical manufacturers make a profit. I know KPI was launched by somebody else who sold it. Is it
definitely now they have been limping because they are given the same. Like you find if you are importing packaging materials like envelopes, you pay tax. But if you bring a packed drug already finished, you don't pay tax on it. So you find those are problems. Like URA is putting in everyday new taxes. Like the last month, they put tax on mother kits. National Medical Stores has failed to supply mother kits
because they're too expensive.
Because of the taxes.
We need another time to really
even pills for mothers, URA put taxes because it says
they even tried it on water.
So I think that those are the government policies which should support access.
You put it very clearly. It's coming from you being a legislator before, so you would know. Well, let's talk to you listeners. This is Spectrum on Radio 1. Our number 0414 348 111 0312 260 390 0312 261 390. When you call in, please tell us your name and your address. Spectrum, hello? Hello?
Yes, hello?
Yes, sir, your name?
My name is Alex. I would like to ask this guy.
Spectrum, hello? Dr. Sematiko, will that you say taxes every day?
Drugs are tax-free, only that when you get drugs from like United States of America, you have to get clearance from National Drug Authority, and even individuals like patients who have self-medications will be not registered in Uganda, but if you get them out, we give you clearance of up to 6 months dose medication. So there's no problem if you get medication from out of Uganda, but we insist that the user must be known, the prescription must be there, and the drugs must be written in the language which you can
understand. Not Chinese, probably. Spectrum, hello? Or Greek? Yes?
Good evening.
Good evening, sir. Your name?
Yeah, this is James Kashaya.
Yes, Mr. Kashaya. Dr. Sematiko.
Thank you, James, for calling. I would say it is true we have a committee in Parliament, and actually it is no longer a Social Services Committee handling health issues. Parliament has, through its good wisdom, decided to put up a committee on health issues alone, and we have interfaced as National Drug Authority with this committee. Also, the act of, which put National Drug Authority in place empowers National Drug Authority to inspect, license, and enforce the proper management and the distribution of drugs. However, there are those bad elements whom we always definitely fight, but I would also like to tell James that quality chemicals capacity cannot satisfy our market as of now. The Uganda relies on over 80% imported drugs. Our local industries manufacture between 20 and 30% of our requirements.
Quality chemicals.
Yeah, both in terms of quantities and the range of products which we need. Some of that technology we have not yet received, like cancer drugs and the rest. So we think we still need to import, but we enforce. Now, as far as the enforcement, it is not entirely true that there is no inspection, no licensing. No. We are doing our level best. But also, the citizens, like James, should help National Drug Authority to report cases of people they see, because they are part of the community. They are your brothers, your sisters who do the wrong things. Once we get whistleblowers, we really go in, and we have arrested many people through that system. Actually, National Drug Authority even has a small fund. When you are a whistleblower, and
give them some cash.
We give you some cash. So I would encourage more people to inform us. We'll definitely do our level best to regulate and enforce the proper use. And also the cabinet last month passed the policy to change National Drug Authority into a food and drug agency. So we are going to improve on the spectrum.
That's what they do in the US.
Yes, that's how it is done in other countries.
Let's hear from you. Your name?
Yeah, I'm Richard.
Yes, Richard. Can you switch off your radio or walk away from it? Yes,
my question is,
yes, doctor.
Thank you, Richard. The problem is, I would say, relatively big, and the biggest target area are like the anti-malarials and the pain drugs. That's why, as National Drug Authority, we have issued an ultimatum that with effect from 1st January 2013, we are banning importation of loose tablets and capsules.
They have to be packaged.
Those which come in tins of 1,000, 500, because
but that will make them expensive.
That is the area which is counterfeited most.
Well, but people won't be able to afford those ones.
Definitely they will afford. The difference is not very big, but you would rather take something slightly more expensive, but you are sure it will do the job, rather than taking a pill which is like a powder.
So what do you mean by fake drugs? Because we also know about generic drugs. Where do you draw the line?
There are several. When we talk of fake drugs, one can give somebody a drug which is expired.
That's a fake drug.
Yeah, because it will not do the job.
Yes.
Secondly, one can give you a drug which is not for the purpose. For example, my colleague here just talked of metronidazole, which is a relatively cheap drug for infection, but one can pack it in a tin and sell it to you as quinine, which is more expensive because they resemble. Then that turns out to be fake. One can give you just powder. So the level of fake is very varied. So it needs a technical person to definitely control. So one advice is to make sure that the person takes drugs from the registered premises. Most fake drugs, 99%, are from the illegal, unregistered outlets.
They sell pancakes, but they also sell Panadol.
Yes, but now, with effect from next year, we want people to get drugs in blisters and only small packs, like of 60 tablets, and only government institutions or public institutions will be allowed in the interim to import the bulk products only.
Mr. Mulumba.
Yeah, I wanted to clarify on one of the things that he said. He talked about the bill that was defining generics as a counterfeit. There are two bills in Parliament currently.
Maybe very briefly, before we come to close, under what circumstances can a mortuary attendant be called a doctor?
Definitely here in Uganda, like in most East African countries, anybody working in a hospital,
they call him doctor.
They call him doctor or nurse. So we definitely know two people: doctor, nurse. Even the male, female doctors are called nurses because people think
all of them are
nurses. So it's now Ministry of Health has instructed national medical stores to buy uniforms for all public officers in public facilities, with the labels and the numbers, and I'm sure by next year you'll enter a hospital and know this is a nurse, this is a male nurse, a female nurse,
like the traffic police.
Definitely.
Those ones it's easy to know.
Yes.
Yeah. I wanted to clarify on the two bills, the anti-counterfeit bill and the industrial properties bill. Now, I think also James made mention of why don't we see legislation coming up. Unfortunately, the legislation that is being suggested, the anti-counterfeit bill, is just focusing on few issues, because counterfeiting literally means forging the
original.
Not necessarily the original, but the trademark.
Yes.
Forging the trademark. So you may have something that is not necessarily a counterfeit, because in legal terms, counterfeiting is about either pirating or forging the trademark.
Yeah.
Now, at times, you may have a substandard that is not necessarily a counterfeit.
Yes.
So this is going to cause chaos.
Okay.
We need to really redefine the two terms quite well, and this has been one of the major issues that we are having.
Maybe on another occasion we'll be able to go into these issues in more detail. But thank you, dear guest. Sorry about Dr. Gordon Sematiko, Executive Director of the National Drug Authority. Thank you for coming to Spectrum tonight, sir. Mr. Moses Mulumba, Executive Director, Center for Health, Human Rights and Development. Thank you for coming to Spectrum tonight. Thank you for tuning in, dear listeners. I've been your host, Edmond. Kizito. Spectrum. We'll be back tomorrow.
Hello, Uganda. This is Regina Bell. And for my very first time ever, I'll be in Kampala for the 5th annual Nile Gold Jazz Safari on October 5th, 2012. Won't you come on out and let's show off together for the Rotary Clubs of Uganda